If you're thinking about getting a nose job, there's something you need to hear first. Rhinoplasty is one of the most popular cosmetic surgeries in the world, but it's also one of the most technically demanding. And while most people do well, there are real risks you should understand before you ever step into an operating room. Hi, my name is Dr. Namita Murthy, and I'm a double board certified facial plastic surgeon practicing near Annapolis, Maryland. As a facial plastic surgeon who has done this procedure many times, I know how important it is for patients to go into cosmetic rhinoplasty with reasonable expectations and understanding of the risks. So let's walk through the top 5 risks of getting a rhinoplasty for cosmetic purposes so you can make a truly informed decision. Let's start with number 1, and this is the one that surprises most people. Patients may be unhappy, and this can lead to the need for revision surgery. Here's the reality. Rhinoplasty has one of the lower satisfaction rates compared to other cosmetic procedures. Studies show that roughly 5 to 15% of patients are dissatisfied with their results, and revision rates in the medical literature range anywhere from about 2% up to nearly 11%. That means there's a real chance that you may not love your outcome, or you may need a second surgery to correct something. Revision rhinoplasty is a complex operation than the first one, and it carries its own set of additional risks. The nasal tip is the area where patients tend to be the least satisfied after surgery. So if your main concern is the tip of your nose, that's an important conversation to have with your surgeon beforehand. Number 2 is breathing problems. This is a big one that many people don't think about when they're focused on how their nose will look. Cosmetic rhinoplasty involves reshaping the bone and cartilage of your nose, and those same structures are what keep your nasal airway open. If too much cartilage is removed, or if the internal structures shift during healing, you can develop nasal obstruction. Nasal obstruction means it becomes harder to breathe through your nose. In the medical literature, nasal airway obstruction after primary rhinoplasty requiring additional surgery has been reported in up to 3% of cases. The good news is that modern techniques focus on preserving the airway, but it's still a risk you need to be aware of. Always ask your surgeon how they plan to protect your breathing during the cosmetic procedure. Number 3 is infection. Anytime you have surgery, there's a risk of infection. With rhinoplasty, infection rates in large studies range from less than 1% up to about 4%. Most infections are mild and can be treated with oral antibiotics, but in rare cases, a serious infection can affect the cartilage grafts used during surgery, causing tissue damage or lead to scarring that changes the final cosmetic result. Signs to watch for after surgery include increasing redness, swelling, warmth, fever, or drainage that looks cloudy or has an odor. If you notice any of those things, contact your surgeon right away. Number 4 is bleeding. Some bleeding after rhinoplasty is normal and expected, but significant bleeding, or what we call a hematoma, which is a collection of blood under the skin, can be a more serious complication. In a large study of nearly 5,000 cosmetic rhinoplasty patients, hematoma was actually the most common complication, occurring in about 2 out of every 1,000 cases. Septal hematoma, which is a blood collection inside the wall that divides your nostrils, is particularly concerning because if not drained promptly, it can damage the cartilage and even lead to a hole in the septum. That's called a septal perforation, and it can cause long-term breathing issues, crusting, and whistling sounds when you breathe. And number 5 is numbness and changes in sensation to your nose. After rhinoplasty, it is very common to have numbness on or around your nose. In fact, studies report that numbness affects roughly 1 in 6 patients. The tip of the nose and the area just below it tend to be the most effective. For most people, sensation gradually returns over the course of several months. Research shows that in primary rhinoplasty, Feeling at the nasal tip typically returns to normal by about 12 months. However, if you've had a revision rhinoplasty, the numbness can be more significant and may not fully resolve. Some patients also notice temporary changes in their sense of smell after surgery, which usually improves as swelling goes down. Now, I want to be clear about something. Rhinoplasty is generally a safe procedure when performed by a qualified, experienced surgeon. The overall complication rate in large studies is less than 1%, but low risk does not mean no risk. Every person's anatomy, skin type, healing response, and medical history are different, and those factors all play a role in your outcome. So if you're seriously considering having a cosmetic rhinoplasty, have an honest, detailed conversation with a board-certified plastic surgeon. Ask about their experience, their revision rates, and how they handle complications. Make sure you understand what realistic results look like for your specific nose, and give yourself time to think it through. This is not a decision to rush. I hope this helped you understand the real risks involved. Remember to hit like on the video, subscribe to the channel for more honest, evidence-based health information. And if you have questions or topics you'd like me to cover, drop them in the comments below. Thanks for watching.